The Alzheimer's Association is speaking out after Medicare proposed to limit coverage of a new drug approved by the FDA to help Alzheimer's patients. The drug Aduhelm is the first Alzheimer's medicine approved in the U.S. to slow cognitive decline. On January 11th, the Centers for Medicare and Medicaid Services, or CMS, released a draft decision stating it would only cover the drug for those participating in approved clinical trials. Catherine Lambert is the CEO of the Alzheimer's Association Western Carolina chapter. She says this decision sharply limits access to the treatment for many people living with the disease.
Many of us do not live near a research institution. If you look at historic enrollment in clinical trials, this further exacerbates other health disparities. African Americans and Hispanics are at a greater risk for Alzheimer's disease and yet are historically underrepresented in clinical trials.
She says denying people living with Alzheimer's disease access to FDA-approved treatment is unacceptable and discrimination.
Going to further exacerbate these health inequities. And honestly, for the entire disease, individuals who have this diagnosis, who have an FDA-approved therapeutic, should have access to that therapeutic, just as you would with cancer or HIV/AIDS or other health issues.
The Alzheimer's Association is calling on CMS to reverse its draft decision. There is a 30-day period for public comment from when the draft decision was announced. A final decision will be announced by April 11th. The association is asking the public to learn more about this decision and add your voice. We'll link that site to our website, WFNYnews2.com. So yes, there on the website, people who live with the disease or might have family members who live with the disease can put comments in their own story as to why everyone should have access to this type of coverage.
I mean, they should have access to this. I had an uncle who suffered from Alzheimer's, and eventually that is what he died from. And it affects so many people surrounding all the family, all the extended family. It's not just something that's happening to that one person in his immediate family. That is a horrible disease.
I mean, I don't understand why they wouldn't even offer it. Like, I feel like this should be a no-brainer. There's a new drug that can help people, a lot of people out there that struggle with this. So why is it not being offered? I don't understand that.
And those with the association think this will just be like a trickle-down effect with all the progress that's been made so far. This is kind of like a step backwards, but people at home, they can read up more on this draft decision. And again, we do have that link on our website if you'd like to voice your concerns about it.
Did you get the feeling it was more of a red tape situation that's what's holding it up, or what do you think?
I think from what I got from it, the CMS was saying as far as some of the trials that have been done, they don't know if there's enough evidence to show how effective some of this is, even though it's been approved by the FDA. So they're like, oh, we'll just let the people in the trials cover it. But they're like, if there is a treatment that's been approved, people should have access to it.
So it's a process.
Yeah.
Okay, makes sense.
Okay.